Sunday, people can begin enrolling for health care under the Affordable Care Act. November 1st marks the beginning of the annual enrollment period. Many of the health plans available for next year will be making changes in their costs and benefits. There are several groups urging El Pasoans who have purchased plans in the past years to check their options. And one of those groups is Project Amistad. And joining us now is Roy Ortega with Project Amistad. Welcome. You are definitely a friend of the show. We welcome you back again. Let's go ahead and talk about where we're at with the Affordable Care Act. Enrollment numbers not as high as projected.
Well, believe it or not, in El Paso County, they're pretty good, actually.
Really good.
Yes, according to Enroll America and according to the numbers that we compile, since the Affordable Care Act was implemented in 2013, there have been a total of 55,131 plans that have been selected from our county. Keep in mind that this is a county that prior to the implementation of the ACA, there were 178,000 people who were uninsured that did not have any kind of health insurance. So when we look at that number, 55,131, that's quite a number, considering the fact that it has such positive implications for the local population here. People who previously did not have any kind of health insurance were in fact able to obtain some very good plans, very affordable in a lot of cases, and so this is a good thing. This is a good thing. You know, you can argue very favorably that it's a lot better to have more people insured in our community than fewer.
Okay. Now, do those same people need to re-enroll, or are we trying to get, okay, so they need to re-enroll, and then people who don't have health insurance that need it need to enroll?
That is correct. Starting November 1st is the open enrollment period that will continue on through the end of January. For those folks who have never purchased any kind of health insurance, this is a good opportunity. For those who had previous plans and want to either make changes or perhaps want to do something else, you know, they want to increase their coverages or whatever, this is a good opportunity. They'll be able to do that, not just with Project Amistad, but with a total of 7 other agencies under the banner of Enroll El Paso. We're all going to be very active starting on Monday, opening our doors and having anyone who needs assistance of any kind, perhaps in understanding, first of all, any aspect of the Affordable Care Act, and we will very gladly help them get through the enrollment process. You know, insurance is very, very complicated for a lot of folks. It's even complicated for us, you know. And so for those folks who perhaps may not have a full understanding of any aspect of the Affordable Care Act, they can come to us, and we have federally certified navigators who can guide them through the entire process from beginning to end and be able to find some very, very good health plans for them and their families. Okay,
so when we tell people there's some new changes this time around, what are we talking about?
Well, there's going to be a large number of plans that are going to be available through the various health insurance companies that participate under the health insurance marketplace. Now, you know, we've been hearing a number of stories. I heard on NPR today, in fact, that there have been a number of people who aren't happy with the coverages that they receive, that perhaps their insurance companies increase their premiums or whatever. You know, there's nothing in the Affordable Care Act that results in higher premiums for anybody. Insurance companies are dealing with some difficult issues as well. But if someone who finds a plan and is trying to make changes for the coming year, they need to look very carefully at what is in their plans, and if they're not happy with that particular plan, there are numerous other plans. They also have to consider the fact that some of them may be able to qualify to receive the tax credits. Some of the information that I brought you here indicates very clearly that 8 out of 10 people that are going to be renewing their plans are going to be able to find plans of less than $100 a month in premiums when you consider the tax credits, and so that's a very positive thing. Here again, if you're not happy, perhaps your insurance company raised the premium for whatever reason, they can certainly get on the health insurance marketplace, look at other plans, and select the one that best suits their needs and their budget.
And it reminds me, if you don't have health insurance, you will be...
That is correct. Yes. During 2016, this is the 3rd year of the Affordable Care Act. If someone does not opt to purchase any kind of health insurance, they may be subject to a $695 penalty when they file their federal income taxes for 2016, or 2.5% of their family income, which could be substantial.
Yeah,
Yes.
absolutely. Okay, so they go to groups like yours, Project
Yes,
Amistad, for
yes.
personal consulting, because that is a lot.
That is correct. You know, there are many people in our community who perhaps may not have access to a computer,
Or just want help getting
they just
through
want help
that.
in understanding
Yeah,
the complicated
absolutely.
nature of insurance. There are people on our staff who are very good, very adept at helping them get through the entire process from beginning to end, and none of the services that we provide cost anything. It's free.
Okay, so where can they find you and when?
They can call us directly at our office, 532-3790, and of course I'll leave you with a list of all the other agencies in town that are doing exactly the same thing we're doing. The important thing is to encourage people to sign up, because having health insurance is very, very important.
Okay, folks, if you didn't catch that number, we're going to put all that information on KVIA.com. And Roy, I just want to thank you so much for stopping by and
pleasure.
enlightening us.
Thank you.
We appreciate it. Time